Narcissistic personality disorder, NPD, is a complex psychological condition that often creates confusion due to its symptoms and manifestations. Among the many concepts related to NPD, narcissistic collapse and narcissistic injury are two that are frequently misunderstood. Although they may seem similar at first glance and can occasionally overlap, they involve distinct experiences and underlying psychological reactions. Narcissistic injury, a definition. Narcissistic injury refers to a blow to a narcissist's self-esteem or self-worth. It occurs when someone or something threatens their grandiose self-perception. This threat can come in many forms, such as criticism, rejection, or any situation where they perceive themselves not to be admired or deemed special. Despite being of an inflated self-image, narcissists are often sensitive to the slightest perceived affronts to their perceived perfection. The experience of narcissistic injury. When a narcissist experiences an injury, their first response is often anger or rage as a defense mechanism to protect their fragile self-image. They may engage in denial, deflection, or aggression, lashing out at those around them to mitigate the impact of their wounded pride. Although painful, the injury is usually temporary, and the narcissist's equilibrium eventually restabilizes, especially if they can reaffirm their sense of superiority. Narcissistic collapse, a definition. Unlike narcissistic injury, which is more fleeting, narcissistic collapse is a profound and prolonged breakdown in a narcissist's self-image. It occurs when the narcissistic injury is so overwhelming or when multiple injuries accumulate to the point where the narcissist's defense mechanisms can no longer support their inflated self-perception. The collapse is more enduring and shatters their self-worth, often accompanied by a deep feeling of helplessness and impotence. Manifestations of narcissistic collapse. A narcissistic collapse can manifest as withdrawal, depression, or significant anxiety as the narcissist is unable to maintain their necessary self-perception. They might become isolated from others and lose interest in maintaining their external facade. In severe cases, the collapse can lead to self-destructive behaviors as the narcissist struggles to cope with the discrepancy between their perceived self and reality. Key differences between the two. The primary difference between narcissistic injury and narcissistic collapse lies in their duration and impact. Injuries are more common and can vary in intensity, often leading to temporary distress. Collapses, however, are drastic and lead to long-term impairment in the narcissist's life. Moreover, the way these experiences are expressed can also diverge. While narcissistic injuries typically lead to defensive and aggressive behaviors, collapses may result in withdrawal and chronic disruption as the affected individual struggles to reconcile their shattered self-image with reality. Understanding these differences is crucial not only for professionals dealing with narcissistic individuals, but also for individuals who may find themselves in relationships with someone exhibiting narcissistic traits. This awareness can lead to better recognition of the signs and more effective interactions and support strategies.